Hi, I'm Dr. Joe Childs, and on this DVD today, what I'd like to talk to you about is some of the metabolic panels and functional nutrition that we do in our office. We do these metabolic panels and we do functional nutrition for patients that come into our office with chronic conditions. So if you're watching this, most likely we've given you this DVD because we may need to do some metabolic testing and possibly some functional nutrition based on those metabolic panels to get you well. And so patients with chronic problems, patients with fatigue, patients with fibromyalgia, chronic pain, insomnia, restless leg syndrome, autoimmune conditions, chronic pain, things like Parkinson's disease, things like rheumatoid arthritis, things like multiple sclerosis, patients that need stroke rehabilitation. These are the kind of patients that need metabolic care. Now, the reason why that's the case, and I want to remind you of the fact that what we're trying to do neurologically in our office is we're trying to get parts of your brain that we find are not functioning well during our exam. We want to get those parts functioning better. So we want to develop what's called healthy neuroplasticity in the brain. And what I mean by that, what neuroplasticity means is your brain is moldable. It can change based on the stimulation that it gets. So let's say we find that the right part of your cerebellum is not working well. We want to stimulate that part of your cerebellum with exercises and stimulation. Now, the brain needs two things to survive. It needs fuel and it needs activation. Fuel comes in the source of oxygen. So we talked about oxygen therapy, which is essential for patients that have chronic conditions. But number two, fuel is glucose coming from your metabolism. So there has to be optimum metabolism to get the brain to change, or the stimulations that we're going to do are not going to work. So for us to get chronic patients well, we need to look at their metabolic panels and we need to treat them metabolically. It's really the missing link. So if your condition's caused by a metabolic problem and a neurological problem and a biomechanical problem, and we only treat you only neurologically and only biomechanically, then we're missing something. So there are 4 priorities when we look at a patient metabolically. So the metabolic priorities are this. Number 1, we need to look for anemias. Number 2, we need to look at your blood sugar and your adrenal function. Number 3, we need to look at the GI function, liver function, and thyroid function. And number 4, we need to look at your fatty acid metabolism. So let's get back to anemia. Why is anemia so important? Well, anemia could be B12 anemia, it could be iron deficient anemia, but basically what anemia means is you don't have enough red blood cells, or your red blood cells don't carry oxygen well. Well, going back to oxygen being essential for brain health, if you don't have proper blood carrying capacity or oxygen carrying capacity due to an anemia, we're never going to get you well. So that's important. So we need to do a complete blood count to determine that. Number 2, again, is blood sugar issues. High glucose, low glucose, diabetes, hypoglycemia, reactive hypoglycemia, insulin resistance. And the other thing is looking at the adrenals. Now the adrenals are the glands that sit right on top of your kidneys. They're called your adrenal glands. And they're very important. They secrete cortisol. So we need to do something called an adrenal stress indices. That's a salivary test. The other thing we want to do is we want to do a complete metabolic panel, which includes looking at a fasting glucose. Now, normal fasting glucose is 85 to 99 when you look at it on your panel. Somebody with hypoglycemia is under 85, or 84 and lower would be somebody with hypoglycemia. Somebody with insulin resistance or pre-diabetes would be anything over 99. Okay? Now, medically, diabetes is based on 127, 2 fasting blood sugars, 127 or above. So this is an important concept to understand because we look at your blood panels from an integrative preventative medicine perspective. Because a lot of patients will come in and say, oh, you know what, I've already had the blood panels done. My doctor said everything looked good. It looked good from a laboratory perspective. Now, a laboratory perspective means this. You know, the reference range that you see on your blood analysis when you get your paperwork back and you see the reference range, and you look and see if you're in that range. Well, where that range has come from is what they do is they test the average of all the people getting blood work. Now, I'm not I'm not too sure how healthy these people are when you look at them getting blood work, because if you go over to Quest and you sit down, you see some pretty unhealthy people in there, and I personally don't want to be the average of all the people getting blood work, unhealthy or not. The functional range is what we use. Functional range was done looking at patients that have absolutely no symptoms and they're as healthy as they can be. What is the median for that? And so we want to be a little tighter when we're looking at trying to get people that are looking for answers well. So another thing that we want to look at is we want to look at autoimmune function. Okay, autoimmune is very important, because if you have an autoimmune condition going on, or an autoimmune process going on, it can really affect you. In fact, autoimmune trumps all of the 4 metabolic priorities. The anemia, the blood sugar, the GI, the thyroid, and the fatty acid. It's trumped by the autoimmune, because the autoimmune could be causing one of those 4 metabolic problems. So what I mean by looking at autoimmune is when your immune system is not working well, it's not in balance, what can happen is your body will actually attack itself. So let's say we're trying to get your brain functioning better. If you have an underlying autoimmune response going on, it could continually be irritating what we're trying to fix. So what makes us think if somebody has an autoimmune problem to begin with? Well, number one is if they're already diagnosed with an autoimmune problem. They come walking in with rheumatoid arthritis, or they have psoriasis or psoriatic arthritis, or they have multiple sclerosis, which is a autoimmune problem, or they have type 1 diabetes, or they have scleroderma, you name it. The list goes on and on with these types of conditions. But you have to understand that the majority of the people that have an autoimmune condition going on, they don't have a named autoimmune condition, meaning they could have went to their medical doctor and none of these things came up positive, meaning they didn't come up positive for any of these disease or named diseases, because a lot of people have an autoimmune reaction going on that's not tested medically, meaning it really goes under the radar, so you don't really know what's happening. Number two is a person that's autoimmune, or a person that we may think would be autoimmune, is the kind of person that comes in and they say their symptoms sort of wax and wane. So some days they come in and they feel really bad, and the other day, yeah, I feel a little bit better, I'm back bad again, up and down, up and down. A lot of fibromyalgia patients have that type of wax and waning symptoms. Or they come in with a boatload of drugs. You come in and you're taking 7, 8, 9 different drugs, and basically what's happening there is your doctor's just really kind of playing Russian roulette with the medications. Let's try that medication. Oh, you know what? Let's see if that one works. Let's see. And the next thing you know, you're taking 15 different medications. Or the last thing would be that your life fell apart, or the condition came about after a major illness. So let's say you have a flu, or you get Lyme disease, and ever since then you've never been the same. Then you've got to think immune system or autoimmune. Or if after a pregnancy everything really went bad, and that's when I started really feeling bad. Now, when you look at the immune system, there's 2 parts of your immune system. There is Th1 and Th2. Th1 are your T cells. Your T cells are sort of the cells that go out and actually do all the work. They go out and kill the viruses. They kill the cancer cells. The T cells are interleukin-2 and TNF-alpha. That's your Th1. Th2 are your B cells. They are your antibodies. B cells, they don't go out and actually do the killing themselves, but what they do is they notify the T cells as to what they need to kill. So they say, hey, this is the problem here, we need to kill it. Your B cells are interleukin-4 and interleukin-10. So basically what happens is, if it's autoimmune, we can look at some blood panels and we can see that one side is higher than the other side. You get an imbalance. There's a dysregulation between the 2 sides of the immune system. That lets us know that there's an autoimmune problem. The other type of autoimmune problem you can have is what's called an active antigen. And what an active antigen means is that your body's been trying to kill something, but it can't kill it. So when it tries to kill it over a period of time, what it'll do is it'll make one side of the immune system go up too high, and that creates an autoimmune problem. An antigen could be any number of things. It could be bacteria, it could be a parasite, it could be a virus, it could be a mold, it could be a heavy metal. It could be a food sensitivity such as gluten, and the gluten creates an autoimmune response in the body because the body's constantly trying to fight this sensitive molecule, gluten, this peptide that floats through your body. So we can determine if it's an active antigen or if it's just immune dysregulation by looking at the ratio between CD4 and CD8 cells. It's called a natural killer cell panel, and sometimes we need to run that for certain patients. Food sensitivity testing. Food sensitivity testing is very important, and basically what we do is we do a test from Entero lab. And what we do is we test you for gluten, we test you for soy sensitivity, we test you for milk or casein allergy, we test you for egg, and we want to look at all of those things because those things can be an antigen which can cause a lot of problems. If you have food sensitivity, one way we can tell, or some of the symptoms that we see patients get, they may get chronic fatigue, they may get indigestion, you may feel bloated after a meal, you may get loose bowels, you may have insomnia, you may get pretty consistent ulcers in the mouth. These are all things that would make you think you have a food sensitivity problem. The other thing that we want to do is we want to look at your intestinal permeability, and we do that test from a company called Genova. And what we do is we want to see how good and strong your digestive tract is at digesting foods and keeping those undigested foods within the digestive tract, because when there are undigested molecules getting into your bloodstream, that can cause an autoimmune problem also. The last thing we want to do is something called a stool microbial ecology test. We do that from a company called Metametrics. And basically what that test will let us know is it'll let us know if you have any parasites, if you have any bacteria, any yeast overgrowth, if you have bacterial problems in that you don't have good, healthy, normal bacteria. Those patients may need to go on a probiotic. So we want to look at everything. We want to leave no stone unturned in determining what's going on metabolically so we can get your body to function better and get you whole and healthy again. Now the question always comes up, do I need every one of those tests? No, because what we're going to do is we're going to have you fill out a metabolic assessment form. And this metabolic assessment form, we're going to look at all of your symptoms. It's going to look at all the different categories. It's going to look at hypoglycemia, hyperglycemia. It's going to look at your digestion. It's going to look at immune. It's going to look at everything. And we're going to see where you've got the majority of your symptoms. And then we're going to base the testing that's necessary based on the consultation that we have with you. So some patients may only need a complete blood panel. Some patients may need a complete blood panel. They may need a lipid panel. They may need autoimmune testing. They may need food sensitivity testing. They may need the whole thing. Typically, the worse off a patient is, the more problems they have, the more testing that needs to be done. So again, we want to leave no stone unturned. Again, one other thing is if we totally avoid the metabolic test, and it comes back, or we find out that you have a metabolic problem, or we don't find out, we don't even look for metabolic, and we only address your problems neurologically and biomechanically, but you have an underlying metabolic problem, it can adversely affect the results that you want. And I know you want to have the best possible results. So you can learn more about this. You're going to get this sheet. Is called What Makes Us Different, How We Treat Chronic Conditions. I think it's in yellow when we pass it out to you. Take this home, read through it. It will go over all the different tests and all the different things that we do in our office to help patients get well. Thanks a lot. We'll go over all your findings at your report of findings.